Hi, I'm Dr. Brett Gilbert. I'm a board-certified endodontist, and I'm going to welcome you along with my patient into the operatory for live root canal treatment. Now, in this treatment, we'll be demonstrating a new file system called the XP4D from Brasseler, USA. We'll also be doing obturation with the match cone system of the XP4D, along with the Ion Plus, a bioceramic sealer product, also from Brasseler, USA, that's new to the market. So let's jump into the operatory, and I'm excited to show you this case and to demonstrate these fine instruments. All right, so we're here. We have an amazing patient. I'm so grateful for him allowing you to join us in the operatory to see live root canal treatment. And I'm going to be utilizing an incredible new rotary system called XP4D from Brasseler, USA. And they really thought through how could they take the existing rotary files that are on the market and really improve upon them. And so what's come is the XP4D. And what you'll find is that in the first 3 millimeters of these files, it's an 0.3 taper, essentially a straight file like you're used to. But as you may have been familiar with what's called the XP3D, it has sort of a loop design above that 3 millimeters. And what that allows us to do is to get great adapted cleaning to the canal anatomy. And so it's a very unique design. So we're going to start out with the starter. That's going to be the 20. And so this is going to be a fairly small instrument. So you can see the starter, this is going to be a 20. You can see that there is a little bit of a loop to it right about the middle of the file here. Very subtle. This is going to be essentially a glide path instrument that we'll use. So we've used just a hand file. We've accessed the tooth, hand file to full working length, which is 22.5 millimeters. And now we'll run this in and we're going to get this cleaned and shaped very, very quickly. So we're using the Endo Pro AI motor, and this has pre-programmed for the XP4D system. So I'm going to go ahead and fire it up. And right what we're going to see here on here is it's going to have XP4D and it's 1000 RPM with 1.0 Newton centimeter torque, okay? We're gonna be using this in full stroke. So of course I'm gonna be measuring it and we're gonna go ahead with full strokes. Irrigate, please. I'm gonna be irrigating with Triton solution. So this is an all-in-one irrigation solution. Has both inorganic and organic debris removal simultaneously. And so what I'm gonna be doing now is I'm gonna bring this in. And so what you'll see here is I'm gonna do full strokes with it. I'm not gonna peck, I'm gonna bring it in, and look at that, it goes right to length. So the size of the canal, as you can see in the pre-op image, is that there is some curvature, but we do have some nice canal space to work with. So now what I'm gonna be going with is the standard file. The standard file is gonna be a 30. Again, it's 0.3 for about the first 3 millimeters, but now you can see more of that accentuated loop. So this part of the file actually has a 0 taper. So the idea is we have easy insertion, smooth apical preparation in the apical third, and then the rest of this file is able to adapt to the anatomy and really clean that 3D anatomy well. So this is the standard, this is a 30, we've already prepped to a 20. So again, always measuring, and this is really nice, easy to measure with this file. We'll go ahead and irrigate, always want to irrigate in between each file. Okay, so now this is the 30, this is the standard, and again, you can see as it starts to spin, how that loop starts to form. And so as you can envision, smooth apical preparation, but then in the middle third where we have the most sort of ovoid anatomy, you can see how it's spinning and it's able to adapt to that anatomy. So we'll bring it in, and again, we want to do full strokes with this. So we bring it in, bring it all the way out and detach, let it come back in again, all the way out and detach. Always a nice idea to wipe the flutes because you see you do get some debris and that's exactly what we would expect. So I'm gonna wipe the flutes. You can use a sponge, you can use a gauze, you can use your glove. So again, I have right now 2 strokes on this standard, the 30, and I was almost to my working length. So again, we're gonna bring this back in, bring it in, and just allow it to go. And there it goes right to the working length, comes out. You can see the debris on the end, and now we're already prepped to a 30 on this premolar. Okay, so we have instrumented this case with the XP4D, and we have finished our instrumentation at the standard file. This is going to be the 30 at the tip. Again, it's an 0.3 taper along the first 3 millimeters. Then it has the loop formed, which helps to adapt to all the natural anatomy inside the canal. Now, I'm not going to be using the next files, but there are 2 more files to the system. The medium, which is 40, and the large, which is 50. So I want to be clear that those files are available for other teeth that you might treat for larger anatomy, but for this case, the the 30, the standard, fit really well. So let's jump in, let's do some irrigation and get this tooth obturated. Okay, it's really nice to use a little micro aspiration tube as well to do that final drying. We will use, of course, paper points as well, so we'll be doing the blue. So the blue again matches. Okay. Beautiful. So I'm going to go ahead and I'm going to place the sealer. Again, this is the Ion Plus sealer. It's going to go about 1/3 down the canal in the coronal third here. And you can see just a little reservoir there of the sealing agent. And this allows us to now use the gutta percha point as the piston. This is called hydraulic condensation, otherwise known as single cone technique. But truly, hydraulic condensation is a better description of how this cone becomes the piston that actually distributes the sealer around the canal spaces. So I'm going to bring this in. We're going to take it right to length here. And now we're going to get one more image, make sure everything is fitting just right, and then we'll get this obturated. Okay, so we have our gutta percha in position with the sealer. The hydraulic condensation is complete, and now we want to be able to sear off the gutta percha. So I'm going to be using the EndoPro Plus. This is going to be an instant hot, almost like what we always described as a System B tip. So we'll go ahead and activate the unit. You can see it displays, it'll go up to 200 degrees Celsius in just one touch, just like that. So you just press the button and this tip becomes instantly hot in that way. It does have a little stopper that you can use if you want to measure as well. But again, with the hydraulic condensation technique, the whole idea really is to just kind of clip off at the coronal end and then use some compaction with a hand instrument to be able to make that good. Okay, so what you're gonna see me doing here is we're gonna go ahead and we're gonna activate the tip. We get it right down inside here. Let me just kind of straighten this out so it's a little bit better visibility. So we're basically just want to kind of clip it right off at the orifice here. And again, it's instant hot when we touch it. And then when we let go, it cools off right away. So we're just going to kind of manipulate this to separate the cone. Great. And then we'll go ahead and we'll use a hand plugger. And again, this is also where the hydraulic condensation comes in because we are going to place some pressure on it. So just taking a little of this excess and we're going to use that to actually help to, and I'm giving some decent pressure here on that top of that gutta percha, which allows that sealer to move around and get us where we need to be as far as really condensing it against the walls and getting it nice and distributed. Because again, we know that there's a variance of anatomy within the walls, and so the sealer is what really goes there. The gutta percha, again, is a match cone system. The gutta percha is going to be the same size as the last file that we used, but then ultimately what we're going to really depend on is the sealer to flow into the anatomy to be able to get this sealed well. So I'm going to go ahead and I'm going to just clean this up a little bit. And actually having a little of this extra gutta percha coronally is helpful in the compaction stage. I'm gonna do the probe once. And the reason is it allows a little more pressure to be applied to that gutta percha in the canal. So you can see all this will be excess. We'll get this all out of here. Again, thank you to my assistants for always having my back here. We love our assistants. Can't do it without them. Okay, so now you see I'm giving some nice pressure here, and that is the completion of the root canal therapy. So now we will restore this with some permanent material. This is a PFM crown, and we're gonna get this patient back on the road and back into life with this infection dealt with. I want to thank you for joining us for this case. I hope you enjoyed seeing the XP4D system in action. We also use Triton solution. We use Ion Plus sealer with the match cone of the XP4D system for successful root canal treatment on tooth number 4. See you next time.